before she had all the treatments. There she is. And here she is now. Ta-da! You're welcome. You look absolutely fantastic.
Thank you.
The first thing I'm going to ask you is, what age are you?
61.
61. Now, taking a look at that photograph earlier on that we just saw there a few seconds ago, did you feel 61 in that? Did you feel you had a lot of lines?
Yes, I did. Yeah.
And you're happy with the result today?
Delighted.
Okay.
Delighted.
Now, I'm going to, Patrick is here as well, good morning, and we're going to go through everything, each of the processes that you had. So, the first one you had was the Polaris laser lift. Now, Patrick, what is that?
I suppose what we're attempting to do in many ways is to either reproduce youth by growing more collagen or getting rid of wrinkles. And the Polaris is a new system that's coming into medicine and cosmetic medicine, where you use radio frequency to cause an insult to the skin in such a way that you fool it, that it tries to repairing itself. Okay, and that was she had first. She also had fillers, Restylane. She had Restylane fillers and also some Bioactimate cheek implants. Originally, Ellen's cheeks were quite hollow, if you remember from the photographs. And this is a new technique that we've actually introduced on a world scale from Dublin for HIV patients that have lost their fat pads. And we've recently had to show this in the United States.
Curl facelift?
Yes, originally invented in Moscow by Michael Suleiman, perfected in Paris by Pierre Fournier, and to an extent we've come up with a simpler way of doing it. And what this means is that you can run suspension sutures underneath the skin. It just takes about 20 minutes, and in some ways try to reproduce what a facelift does.
And is this pulling back the skin, is it? Is that what you did, in simple terms?
Technically, that's what you're doing,
okay,
yes.
And do you cut the skin?
Not really. You just make a little
incision
for the sutures to come back out through. Now, it's obviously not going to be probably as good as a facelift. It can slip.
So it's kind of pulling, like tightening like
absolutely.
This, like if I were to do this?
3 planes, absolutely.
Okay, Grant. But just to simplify the whole thing, okay, you also had Botox. That's what we all know, Botox.
Yes.
Yeah.
Botox, I suppose, at this stage is the tried favourite. It's been around long enough. Most people know that it's not going to cause any major problems.
It freezes the muscle, basically.
Absolutely, and takes away the wrinkles.
And what was the last one? You had the cells taken behind the ear as well. We saw that just there as well.
Solagen, this is really the way that cosmetic medicine is going also, where we're almost into the biogenic stem cell end of things. We take the repair cells from the body, inject them back into the patient's face, so technically it can almost make them grow younger just by looking into the mirror each morning.
It's transplanting cells, really, isn't it?
The repair cells back into the areas where they're required, around the eyes, into the forehead, and it grows out wrinkles. So most patients like this because it feels to the patient like they're doing it themselves. They're not introducing something artificial, either like hyaluronic acid, a plastic, or even a toxin like Botox.
Okay. Ellen, how did all this feel to go through the process of this? Because a lot of women watching this morning especially will say, you know, I'm thinking of this, or I might be thinking of Botox, or I might be thinking of fillers. But a lot of people would be kind of nervous as to the effects afterwards, or worried about side effects, but also that it might hurt. Did it hurt you?
The Polaris was a bit uncomfortable. In relation to everything else, it was totally pain-free.
What about Botox? No pain?
No, not at all. Not at all.
And do you feel that you've lost expression in your face now?
No, not at all, because it's not invasive treatments I've had. They've been very, very gentle, I would say.
Yeah.
If there's any discomfort at all, there is a cream, an antiseptic cream.
Yeah, but in the sense of you just...
I don't feel... I feel better. I feel I've got more confidence. I feel I've got some of my self-esteem back, thanks to the skills of Dr. Patrick, and of course the makeup that has been put on me this morning, I think it's called.
Yeah.
And Barbara did your hair, and she did a lovely job with your hair this morning.
Yes.
Gorgeous.
Yes.
So you've had the hair done as well. You have all the highlights in your hair. It's a much more youthful look. And looking at the photograph of you just there are a lot more wrinkles, especially around your mouth. Did you feel that yourself?
Yes.
Yeah.
But I feel that they're gone now.
Yeah, they certainly are gone.
No pain, and I would recommend anyone who's thinking about it
to make
sure who they go to. First of all, I mean, I had great faith in Dr. Patrick because I read up everything on him.
Of course, the Aylesbury Clinic has won this big award that we have here this morning.
Fantastic, yeah, we just won Best Medical Practice in Ireland a few weeks ago, and that was mostly for the minor surgery procedures also. We decided to introduce an Australian model to Ireland that sort of people could, for the first time, just walk in and get procedures done without necessarily...
How much would this cost, all of what Ellen had done?
Most of it isn't particularly expensive. The most expensive part, probably more, is a cellulent transplant.
Yeah.
And
what cost are we talking about, Patrick?
That's 4,000, but it costs us from the company 3,500 to store the cells and all the rest.
How long does it last?
We're not sure. FDA trials tend to show that it lasts about 7 years.
Okay. It's not expensive for 7 years, $4,000. If you're going to go out and spend that kind of money.
That's right. The Curlift, we haven't really made a proper price for. It'll probably sit somewhere between 1,000 and 1,500. But compared to a facelift, which costs about 10,000 or more, it's obviously.
Okay. And the Botox, how much is it for a regular Botox? Normally,
we divide a face into 3 different areas. The frown lines is 1 area, the forehead is 2, and around the eyes is 3, and that's usually 250, 350, and 450.
Okay, excellent. Well, you look fantastic.
Thank you very much.
And thank you very much to Dr. Patrick Tracy.
Yeah.
Thanks also, Mara.
Have a good Christmas to both of you.
Thank you.
Thank you.
Now, after the break, underwear that won't keep you warm, but they'll make you feel fantastic. And what more would you want this Christmas? Stay with us.
Air Talk.